The DeRoyal Lumitech Incisional Wound Dressing is a unique, sterile, multi-layer surgical dressing for use over incisional wound sites. It is intended to manage closed post-surgical wounds with low to medium drainage. Lumitech dressings are compatible with negative pressure wound therapy (NPWT) systems that are cleared for use with appropriate, commercially available wound dressings as selected by a clinician based on the wound requirements or on a physician's prescription. Lumitech incisional wound dressings create a barrier against contaminants, support the removal and absorption of exudate, and support wound healing when used in conjunction with NPWT. The Lumitech dressing is composed of multiple layers that include an integrated wound contact layer, fluid-absorbent nonwoven fibers, pressure-distributive polyurethane foam, and an innovative, protective, breathable, water-resistant polyurethane film border incorporating Lumina adhesive technology. Lumina adhesive technology is a patented, switchable adhesive film that supports a strong seal and long wear time while still allowing for gentle dressing removal using a UV light. Prior to the application of the Lumitech dressing, ensure the incision site and surrounding area are thoroughly prepared, cleansed, and dried according to the instructions for use. Assess the wound site. Select the appropriate Lumitech dressing size for the incision site, allowing for complete coverage of the incision site under the dressing island. Open the Lumitech dressing package, which contains the following: Lumitech dressings, Lumitech securement strips, instructions for use, a DeRoyal UV flashlight, available separately or in a convenience kit, is optional but recommended for gentle dressing removal. To apply the Lumitech dressing over the incision site, first remove the bottom center release liner by peeling it from the back of the dressing. Next, holding the side tabs, position the dressing over the center of the incision. Once positioned, allow the adhesive border to affix to the desired location. Carefully remove the remaining bottom release liners, starting at one corner of the dressing and patting down the adhesive as the release liner is pulled away. Repeat these steps for the other side. Gently press down around the dressing adhesive border to secure the adhesive and minimize wrinkles in the border. Carefully peel away the top carrier layer tabs, ensuring dressing border is secured. If additional securement is needed for attachment to skin or to minimize leaks in the perimeter of the dressing, use the additional Lumitech securement strips that are provided in the dressing's packaging. For use of Lumitech dressings in conjunction with negative pressure wound therapy, follow the manufacturer's instructions for application of the system over the dressing. Lumitech incisional dressings are designed to remain in place for several days and can be worn during normal daily activities. With physician approval, the Lumitech dressing may be worn while showering, though care in keeping the dressing out of direct spray of shower water is recommended to prolong wear. Do not expose the Lumitech dressing to direct sunlight, as the dressing incorporates a light-sensitive adhesive technology that supports gentle removal. Direct exposure to sunlight may release the dressing prematurely. If potential sunlight exposure exists, cover the dressing with loose-fitting clothes or a breathable wrap. Change the dressing as needed when it becomes heavily soiled or saturated, leaks, or as directed by licensed clinician. The dressing's adhesive border incorporates Lumina adhesive technology that reacts to specific UV light wavelengths. Although not required, the use of a UV light is recommended for a gentle dressing release and is provided in the dressing packaging. If releasing with UV light, please use the provided DeRoyal flashlight or contact DeRoyal for options. Focus the UV light 1 to 2 centimeters above the adhesive border. Slowly sweep the UV light across the adhesive dressing border, allowing 3 to 5 seconds of exposure for each area of the dressing border. To remove the dressing, hold the edge of the adhesive border and carefully lift the dressing from the wound. Once removed, dispose of the dressing in accordance with facility's protocol and local requirements. DeRoyal's Lumitech Incisional Wound Dressing, advancing the wound healing experience.